Today in the United States, few people understand or can agree about Obamacare. In fact, 4 out of 10 Americans are unaware of the current status of the healthcare law, whether it's been overturned by the Supreme Court or repealed by Congress. This video was created to help Americans understand the Affordable Care Act, as Obamacare is officially called, and consider its fiscal and moral trade-offs. The ACA was passed by Congress and signed into law by President Obama on March 23, 2010. It was designed to respond to the rising number of uninsured Americans and the rising costs of healthcare. The ACA is the most significant overhaul of the U.S. healthcare system since 1965, when Medicare and Medicaid were created by the Lyndon Johnson administration. Medicare provides healthcare to the elderly, and Medicaid provides healthcare to the poor. Universal healthcare is usually depicted as a Democratic cause, but over the past 50 years it has been supported by Democrats and Republicans. While LBJ, a Democrat, created Medicare and Medicaid, Richard Nixon and George Bush, both Republicans, expanded Medicare to cover more disabled people and to pay for prescription drugs. And it was Ronald Reagan who required hospital emergency rooms to treat all patients, regardless of their ability to pay. There are about 266 million Americans under the age of 65. About 56% have health insurance through their employers. 21% are covered through Medicaid or other government programs. 18%, about 50 million people, are uninsured. The ACA uses 3 tools to increase healthcare coverage and affordability. These tools are mandates, health insurance exchanges, and Medicaid expansion. Let's start with the mandates. First, there's the individual mandate, which requires that by 2014, uninsured Americans get health insurance or pay a penalty of about 1% of their income, going up to 2.5% of their income by 2016. Who are the uninsured? They are mostly low income, but many are in the middle class. About 38% have incomes under $22,000 for a family of 4, which is below what's called the federal poverty level. What about the ages of the uninsured? Well, the largest group are the middle-aged. After them, the 2 largest groups are young adults. 57% of the uninsured are employed. 80% are U.S. citizens. The ACA's second mandate requires that, come 2015, employers with 50 full-time workers or more provide health insurance or pay a penalty of about $2,000 per worker, excluding the first 30 workers. Currently, more than 90% of companies with more than 50 workers provide health insurance. The second tool of the ACA is the health insurance exchanges. These are websites that will be run by the state or federal governments. They will be a place where insurers can advertise and sell their coverage options. Starting October 1st, individuals and families will be able to choose from 4 plans: Bronze, Silver, Gold, and Platinum. The plans will vary in quality and in cost. As this chart shows, the Gold plan covers 80% of healthcare expenses, whereas the Bronze plan covers only 60%. Insurers accepted to the exchanges must offer a package of benefits. This includes emergency, maternity, pediatric, preventative, prescription drug, and mental health benefits. Insurers cannot deny coverage to people with pre-existing conditions. The Congressional Budget Office now estimates that 26 million people will enroll in these exchanges. The exchanges sell health insurance at a price that depends upon income. A lower income person will pay a lower premium. This is achieved through subsidies and spending caps. For example, the health insurance premium for a family of 4 who makes about $35,000 a year will be 4% of their annual income, or about $1,400 a year. Their maximum out-of-pocket spending limit will be about $4,000. The rest of the family's premium health expenses, or about $10,000 a year, will be subsidized through tax credits. A third tool of the ACA is the expansion of Medicaid. As you can see from this chart, Medicaid currently benefits mostly poor children, pregnant women, and people with disabilities. Children, on average, qualified for Medicaid in 2012 if their family's income was below 250% of the federal poverty level. For a family of 3, this equaled $48,000 a year. Eligibility decreases significantly for working parents and jobless parents. Adults who do not have children and are not disabled do not qualify for Medicaid, regardless of their income. The ACA's biggest change to Medicaid is that it enables more people to qualify by raising the minimum eligibility to 138% of the federal poverty level, or about $15,000 for an individual, and $26,000 for a family of 3. The ACA was complex enough, but in June 2012 it got more complicated. The Supreme Court decided that the individual mandate, which requires Americans to obtain insurance, was authorized by Congress's power to levy taxes. But the court also decided that states could opt out of Medicaid expansion. The court reasoned that forcing states to expand Medicaid or lose their current Medicaid funding was an invalid exercise of Congress's spending power. The decision essentially cut the power of the ACA in half. To make sense of the disagreement surrounding the ACA, watch part 2 of this video.